the point of view of the Nigeria Center for Disease Control, we think that the hesitancy may not actually be as strong as it is to the COVID vaccine, that there's actually a lot of pent-up demand for this vaccine. But rather than just react to what people are saying, we want to actually pick up the data from different parts of the country, different strata of society, to really understand people's perceptions, what is driving those perceptions at different levels of society, so we can address them adequately. So we have found out that very often what the loudest voice says doesn't really represent the thoughts, emotions, knowledge, and decisions that people make. So this project, together with the University of Lagos, a very strong academic partner, with them we will understand from various sources of data what people really think and use that to inform the national response and make sure more people access this life-saving intervention that vaccines provide. Actually, in Nigeria, there are many data sources. We're a very big country. I think we've done very well, actually, in collecting data. What we haven't done well is in linking the data sets in the various bits. So we have BVN, we have National Population Commission collecting data, INEC collecting data, NCDC, NPHCDA. So which is really the underlying goal of this, is to collect this data, pool them together, and use them to make decisions. And hopefully, through this project, we can actually drive better collaboration across the various ministries, departments, and agencies that collect various data sources to make sure our political leadership really have the information and the data they need to make very hard decisions about our country, not just on the prevalence of disease, but on the population, on what they're understanding, on their perceptions, and on various other indicators that come into that decision-making process, the level of education, the number of people living in urban versus rural. So there are many indicators that will enable us understand our problems more and ultimately support us in making the best decisions for our country.
What is it? Let data inform us. We are running a country. The dialectics of data versus this sociological context in which you interpret data must always be a dialectic that must be thought about at all times. And this is the gravamen of what it is that this thing needs to do. When they said COVID partners had contributed 21 billion, the first impression at the time was that if you lock people down and they can't buy food and they can't do anything, why don't we distribute the money? I said I wanted to know how many poor people we actually have. This is our first test. I would rather the Ministry of Communications give us a 333 code to whom everybody will send help every week so that we can send them 3,000 naira, because big men will not apply. The only people who apply are poor people. And immediately I would know how many people who are interested. But when we missed that opportunity for that data and took an alternative route, the Governors Forum, they've not recovered from that. So when you're going to be hearing from the citizens whether they trust the government, by the time we got to NSAS in October, they were now seeing where the COVID palliatives were passed. They got to fire this government. That was because we misjudged an aspect of the data that we were supposed to use. So when I had and got this invitation, I saw a new opportunity. You're going to please help us. This is an opportunity that, yes, Oyibo people from France are funding, but they're going to be Nigerians operating this. So whatever data you're producing, we're going to be a demand side who will actually use this data. We want to know the total population in Nigeria who didn't come in contact with this. Why? The tests we perform in Nigeria is very misleading, because only the few people who have been testing from the beginning are the ones being repeatedly tested. They've tested me about 10 times. I'm tired of the testing, sir. So you can see 3 million tests, but you've applied them only to 300,000 people over the past 1 year, because we do not have a national identification number to go with it. Why is that? Every other place, if you are testing in the US, they ask you for social. So at what point do we then decide the integrity of this data if I'm determined to interrogate it? Because if you ask any woman, and this is not peculiar to women anyway, the tendency is to hesitate around age. If you ask her age, say, why are you asking me? So if it's a young girl that you ask, she wants to increase the age a little bit to show that she's also part of what is going on. So if you've missed a 17-year-old girl who claims she's 18, how is your data accurate when you're going to do the demographics of who does what and in what response? You've already missed 5,000 primary schools, out of which federal government owns only, the state governments own about 35,000. State individuals own and institutions own the rest. If you decide that you want to shut down schools and you won't help nearly 1 million teachers who are going to be off lesson, what do you expect them to say when you ask them a COVID question? They say, thunder, fire, both you are in federal government.
The COVID, I will call it disaster, which led to millions and millions of deaths. And my team had been a bit proactive. Even during the lockdown, they decided not to just sit down, they decided to investigate to see how our social influences, how their day-to-day living would be impacted by the COVID, and what factors we may need to take, what things we may need to do in case we have a resurgence of the COVID. We are now having the third, but more importantly, what if something worse than COVID comes? Then this, of course, this project will give us information and enable us to be able to have a more proactive plan, to have a more proactive time that may actually help us to manage whatever is coming. It's going to be about 6 months. We're expecting it to terminate October 22nd, I think, or November 20th, but it's going to be a 6 months program, and hopefully when the results, the data collected is obtained and managed, then we'll have more information on how we could do so.
Across this country?
Across the country. Well, it will tell us a lot of things. Before the advent of vaccine, the lockdown helped immensely. Social distancing helped immensely, but we are now delving into much more details as to what we need to do. Do we still maintain social distances? Are there any other compounding factors that we didn't consider when the first wave came in? So these are some of the questions that's going to ask. Community medicine, it's simply the answer to the question. And so we have to get more details as to how to combat whatever illness is coming in the future.
Please, if I call your name, you just stand up for recognition. Dr. Babashala Okushanya of the College of Medicine. Please, if I call your name, you just stand up for recognition. Dr. Babashala Okushanya of the College of Medicine. So the essence of this meeting is first to introduce the data. You didn't see this beautiful map when I was presenting. Move on to the next slide, please. Of Nuffield Center for International Health and Development, University of Leeds, UK, is actually joining us online, and we've heard his voice before now.
Congratulations to the team. And we have the work cut out for you now. Thank you. Now talked about the impact